the young bloods that we had through as MSc students in those days, most of them went on to have very good careers in clinical biochemistry, and one of them went to work with Vincent for many years, and that was Jack Solway.
And then in Guildford, really the two MSc courses competed with each other at a very high level.
Well, we competed, but in fact there was a need for our MSc, their MSc, and in fact then eventually London set one up. There's no doubt that there was a real need. Most of the students who came through us have finished up, those who stayed in the NHS at consultant level. I mean, many of them have now retired, but they became the leaders of the profession, and coming to an ACBE meeting was a joy to return.
You had two meetings, I think 2 consecutive years in the 80s on point of care testing.
We did. We were the pioneers of point of care testing. Well, we were the pioneers, and we had the first congresses anywhere in the world. I mean, fortunately they were internationally popular, and they really set the scene for what has now become commonplace. Or it took not much longer than I thought it would.
I think your research trust fund must have benefited hugely from those very successful meetings. But Peter, what I do ask you is that those point of care testing meetings in the UK set the scene. To me, point of care, the reason it's taken so long to develop is because we still can't measure a CRP, a hemoglobin, and a TSH on one instrument. We have,
well, I think
technology's lag behind.
I think the trouble is point of care really is synonymous with glucose testing for years and years. It was the only viable point of care test being done, and this, of course, has mushroomed beyond any recognition to a point where arguably much of the testing that is unnecessary.
Yeah, so tell us what you did in America and what the differences were when you went from the UK that was developing clinical biochemistry to the States.
Well, I took a peculiar route in that, having worked in the UK for really 15 years or so, 7 years altogether at the Queen Elizabeth Hospital in Birmingham, and I'd had 2 years in London. I was attracted or offered a position in the diagnostic industry in North America. And I went and eventually became vice president with the Technicon Corporation, where I spent 5 years. And that really opened my eyes, because there's always been an element of distrust, I think, between those in industry and those who were respectable, if you like. And what I learned is that there was a phenomenal amount of professionalism and competence in that industry segment, and the idea that you take a little vial of frozen serum, etc. Very few people who use it in the clinical lab are appreciative of just how difficult it has been to create that and meet all of the regulations. So altogether I spent 9 years in the industry.
And then you went back
and then I was offered a full professorship at the University of Pennsylvania. Both Vincent and I have had the privilege of working in the profession during a phenomenal growth phase, and that's what really made our job exciting. I feel sorry in a way now that those in the profession are actually seeing cutbacks and hurdles to their expansion and their growth, both professionally and in terms of the whole community.
You did establish several private companies to try and take things forward, didn't you?
Over the fullness of time, we set up quite a substantial company to create anti-sera.
And that was called?
Well, that was Guild Hay, and Guild Hay was initially set up just to supply my research groups, and then we supplied free various hospitals in Britain, but realised you couldn't do this without backup. So we had to set up a company to bring in money, and we then started selling to commercial companies, and we became major distributors of anti-sera and creators of anti-sera. So we started a farm. I had a farm on a hospital site, because the old mental hospitals in Britain used to have farms, and they were all being sold off because it was decided that Minister of Health wasn't in the farming business, and we saved one by saying we needed it for health purposes.
Yeah.
And we had a farm of sheep,
Yeah.
donkeys, rabbits, in which we raised anti-sera. That was before the days of monoclonals.
Sure.
Monoclonals came along and we really didn't manage to get our hands on that, but we started another company to purify monoclonal antibodies. I did that in conjunction with the professor of chemical engineering, and that we licensed the technology that we developed to a very large well, it's now a very, very large corporation. Unfortunately, we didn't have the nous to make sure that we got the protection that we should have done.